Hi, my name is Brooke Dearlandis, and this is my infomercial on cocaine. So what is cocaine? Cocaine is a stimulant that is derived from the leaves of the coca plant that is found in South America. It is considered to be a Schedule II drug because it presents medical use, but also presents high potential for abuse. Methods. Cocaine can be administered in several different ways. It can be administered intranasally, in which it is snorted in the nostrils, orally, which means the user puts it on their gums, intravenously, which is done when the user mixes it with water and injects it into their veins, and lastly, inhalation, in which the user smokes it. Impact on the community. It has been found that adults aged 18 to 25 have the highest rate of cocaine usage, and males seem to have higher rates than females. Cocaine remains the second most popular illicit drug behind marijuana, which comes in at first. In 2014, 913,000 Americans met the criteria for dependence or abuse of cocaine, according to the Diagnostic and Statistical Manual of Mental Disorders. In 2016, there were 5,500 deaths from cocaine, and in 2012, almost 4.7 million people aged 12 and up had reported cocaine use in the past year. There has also been a recent increase in overdoses, which comes from using cocaine that is mixed with opioids. Effects on the body. Cocaine has many effects on the body. The short-term effects include narrowed blood vessels, increased body temperature, abdominal pain and nausea, anxiety, erratic and violent behavior, paranoia, heart rhythm problems, and depression and mood swings. The long-term effects include loss, sense of smell, nosebleeds, nasal damage and trouble swallowing, which are all attributed to snorting cocaine, lung damage if smoked, poor nutrition and weight loss, and bowel decay if cocaine is consumed by the mouth. Risks and consequences. People who use cocaine should be familiar with the risks and consequences that come with using the drug. First and foremost, a risk when using it is overdosing on it. You can also get arrested or have it on your record that you got caught with cocaine on you. There are risks of seizure, stroke, and heart attack, especially when doing too much. Using cocaine that might be mixed with other drugs like fentanyl can be very deadly, and that is a risk with cocaine since most people don't know what is in the cocaine that they are buying. There is an increased risk of HIV and hepatitis C due to weakening of the immune system and from sharing items that might be infected. Lastly, mixing cocaine with alcohol can lead to a higher risk of cardiac toxicity, which is damage to the heart by harmful chemicals. Treatment. Currently, there are no medications approved by the FDA for cocaine addiction, but researchers are testing some treatments that are used for other disorders like alcoholism, obesity, and opioid addiction. There are different treatment options, though, for someone who is abusing or dependent. One type of treatment is contingency management, which is also sometimes referred to as motivational incentives. This is when programs use a voucher or a prize-based system that rewards patients who abstain from cocaine use. Another type is cognitive behavioral therapy. This is a good form of treatment for preventing relapse. This approach helps patients develop critical skills that support long-term abstinence. Another type is therapeutic communities, which are drug-free residences in which people in recovery from substance use disorders help each other to understand and change their behaviors. And lastly, community-based recovery centers, like Cocaine's Anonymous or 12-step programs, that can help in maintaining abstinence. These are my references. Thank you for listening to my infomercial, and I am looking forward to everyone else's.